Hello friends, welcome back to our channel. Today we had a new patient named Taisiya. She came to us with some serious complaints. She's been working in the food service industry for over 10 years, and as a result, she's developed persistent pain in her legs and a very tight neck and shoulder region. She came to us based on a recommendation, hoping to figure out what's going on and how to handle it. This isn't a new issue for her. The symptoms have been building up over time, but she didn't pay them much attention in her younger years. Now, the condition has worsened, and it's begun to interfere with her ability to work. She's finally decided to take her health seriously. She vaguely remembers seeing a manual therapist once before, but it was so long ago that she can't recall what was done or what the diagnosis was. All she knows is that someone once mentioned she might have a mild form of scoliosis. She also carries heavy items at work and doesn't follow any kind of consistent daily routine. In a pre-op exam, she underwent breast augmentation with implants. Her doctor noted that she might be at risk for developing varicose veins. She had a vascular ultrasound, and it showed early signs that require monitoring. They advised her to walk more, take contrast showers, and keep an eye on circulation in her legs. Let me pause here and make a note for our viewers. Varicose veins are no joke. I always recommend contrast showers, if there are no contraindications, leg massages, and ideally, full-body massages. Steam baths are also great, again, if allowed. Most importantly, regular physical activity is crucial to keep blood circulating properly, especially in the lower limbs. Back to our patient. Upon examination, I immediately noted signs of kyphoscoliosis. The thoracic spine is quite rounded, and her posture shows clear asymmetries. When we tested torso rotation, it was harder for her to turn to the left, which might suggest a rotational vertebral misalignment or muscular shortening on the right side. In the prone position, it was easy to see the tension in her lower back. Her lumbar spine was in hyperlordosis, and the paravertebral muscles were extremely tight. We began with some preparatory massage to relax the tissues before moving into deeper manual therapy. During massage, Taisiya mentioned something she hadn't said earlier, that her legs start to ache and feel heavy by the evening, especially after standing long hours at work. That symptom strongly suggests venous insufficiency, and I recommended that she start wearing custom orthotic insoles to improve shock absorption and reduce fatigue in the legs. As we moved into manual adjustments, I focused on the lumbar spine first. With some coaxing and guided breathing, we were able to achieve good mobilization. Then we transitioned to the thoracic region. Tension began to ease, and I could feel the muscles responding well. The next area was the cervical spine. Here, we ran into some resistance. Her neck muscles were tight and didn't want to let go. I had to work slowly, using gentle decompression techniques. It took some effort, but we finally achieved full cervical traction. Once she relaxed and let go of the fear and tension, the result was excellent. A clean, effective release. We wrapped up the session with some functional stretches, lateral stretches, fascial extensions, and chest opening work targeting the major and minor pectorals. These areas were quite restricted due to compensatory patterns in her posture. We also performed spinal decompression in the supine position. Taisiya felt a clear difference afterward. Her movements were freer, her back felt lighter, and she had a much wider range of motion. When she repeated the rotation tests from earlier, she noticed immediate improvement. For the future, I recommended regular massage, corrective exercises, and custom insoles. Most importantly, don't ignore these warning signs like she did. Prevention is much easier than repair. So, that's our session for today. Thank you all for watching. Be sure to subscribe, leave a like, and drop your comments below. Take care of your health, and see you next time.